instruments has been used many different ways, and everybody have shown their interest and how good it is, because basically it's like a program. So there is very little you can go wrong about it. Unlike a cadaver, you make a wrong section, then obviously you're not going to get it back. You don't have option of making an undo or something like that.
Mr. Abbas, please be careful. Talk about these options.
Sure, I will do it now. Okay. So as I mentioned to you, some of them are just new, so I'll just explain this short. One finger we will use for rotation. Okay, one finger. Two fingers we use for pan, just to move the image. Okay, we use for pan, and the other two fingers is for pinching, they call it. Pinching is basically for increasing or decreasing of the image, zooming and zoom in and zoom out. Okay, the other image is once you have a section, once you make a section, the image will not cut automatically. You have to move the image. Unless you move, the image will not cut. Okay, so once you use the tool and you are thinking, oh, why it's not cutting, so you have to move slightly, then you will see the section of it. Okay, and the three fingers, we can use the three fingers for increasing the section or decreasing the section, because I make a cut already. So now I want to increase the section. If you use it vertically, the system will respond slowly. So better to use it horizontally. Yeah. So you can increase, and then if you want to go upside, it will decrease the section. Okay?
You can also see the soft tissue, not only the bone or the muscle.
Yes, you can. You will be able to do that. But that you have to do it in high resolution images, not on the full body. Because you see, the more resolution you add on the body, the image will get very heavy.
We can choose the system we want to.
Exactly. What you can do is, there are list of high resolution scans, right? So all this one, like most of them are whatever your interest will be here. Liver. So you can just check it over here. Oh, I don't know, liver. Heart, kidney is there. There are two options here. One is high resolution images. One is image library. In image library, basically these guys are just trying to discuss. In this one, you will find a lot of images. Like these are, some of them are for veterinarian, like dogs, sheep, dog, mouse is there, umbilical cord for. So more than 800 cases are there. Basically, these are considered as case files, okay, where, for example, I'm touching this. A specific case of, for example, brain perfusion. Here, before you give a lecture to your students, here is a description of what they be, and these are real-time images. The most important is that these are real patients, okay, from the various hospitals, obviously, okay, from various hospitals. And since they, in Europe and America, they can't disclose the name or anything of the persons, what they try to do is they just say that this particular case for brain perfusion is a female, an age of 55 years old, okay? And they gave her what are the different symptoms they have found it in that particular image. So before you give a lecture, you can just go through. These are basically a medical, very pure medical thing. So you have to read this carefully. So what they have found and things. Then once you open it, you can say the same thing to your students. Just asking them what are the abnormalities they are looking at the image, they can see it, okay? Once they say you something, then you can continue a lecture saying that this particular brain have a particular specific disease, perfusion and things like that. And what we have noticed is just by reading that, you can just say them the same thing. So there are more than 800 or 1,000 cases here, okay, in this image case library. More than 800 or 1,000 images are there. So the only thing is, like, you have to, whenever you have time, just go through it, go through it and see what is the best which might be the best thing for you, which suits your curriculum. Various embryos and things are there. You have to be, when you are trying to start out, just be specific in when you click it, because once you click this one and click the other one, what it tries to do is, it will take images from here, it will take images from here, it will club it, and all will be there. Then it will be difficult sometimes for you to scroll down. So if you want interested in only in umbilical cords or embryos and things like that, specifically click that section. There are a lot of different embryos are there at different stages if you are interested in talking about it. And each